Today, we will talk about a crucial topic for health: bad habits that destroy your kidneys and the importance of taking care of these vital and silent organs. Located in the lower back, the kidneys play a vital role in filtering blood, eliminating toxins, and balancing fluids in our body. They regulate blood pressure and control the balance of fluids and electrolytes in our body. However, certain daily habits, often overlooked, can put your health at risk and compromise its proper functioning. Did you know that a large number of people in the United States could be battling kidney disease without even being aware of it? It is estimated that more than 20 million Americans suffer from some level of kidney disease, making it a major public health problem. The seriousness of this situation lies in the fact that many of these individuals do not present obvious symptoms in the early stages, which delays diagnosis and timely care. Why do so many cases go unnoticed? Kidney disease often develops gradually and silently. Additionally, there are several factors that can increase the likelihood of developing kidney disease, such as diabetes, high blood pressure, obesity, smoking, and excessive use of certain medications. The kidneys, like silent heroes, perform crucial functions. However, when these organs are affected by various conditions, their ability to function properly deteriorates. Kidney diseases go beyond just affecting the kidneys. Its negative impact extends to the entire body, putting the functioning of other vital organs and systems at risk. Among the main consequences of kidney diseases, we find heart problems, high blood pressure and electrolyte imbalance, common in kidney disease, increase the risk of heart disease and heart failure. Bone weakness. Kidney disease affects the production of vitamin D, essential for calcium absorption. This can lead to osteoporosis, bone fragility, and an increased risk of fractures. Weakened immune system. People with kidney disease are at increased risk of infections due to a weakened immune system. Neurological problems. Toxins that are not properly removed by damaged kidneys can accumulate in the brain, causing neurological problems such as confusion, seizures, and even coma. It can also cause kidney failure that requires dialysis or a transplant to survive. But did you know that some of your daily habits could be damaging your kidneys without you knowing it? In this video, we will reveal 10 daily habits that can damage your kidneys and how to stop them before it's too late. So, without any more preambles, let's get started. Number 1. Taking too many pain relievers. While over-the-counter pain relievers are common and easily accessible, it is crucial to be aware of their potential negative impact on kidney health, especially for those who suffer from kidney disease or consume them excessively. Excessive or prolonged use of these medications, particularly nonsteroidal anti-inflammatory drugs such as ibuprofen and naproxen, can seriously damage the kidneys. People with pre-existing kidney disease are particularly vulnerable to the harmful effects of pain relievers. Even small doses of these medications can worsen their condition and lead to serious complications. The US-based nonprofit National Kidney Foundation says these drugs can reduce blood flow to the kidneys and cause inflammation and scarring in kidney tissue, making it harder to filter and eliminate kidneys of toxins. Painkillers such as paracetamol and aspirin can also damage your kidneys if you take them too frequently or in large quantities. So what can you do to protect your kidneys from painkillers? To protect your kidneys, it is essential to consult a doctor before taking any over-the-counter pain reliever, especially if you have kidney disease. Strictly follow dosage instructions and do not exceed the recommended dosage or take the medication for longer than necessary. If you have chronic pain, talk to your doctor about other ways to treat it, such as physical therapy, hot or cold therapies, relaxation techniques, massage, acupuncture, or meditation. If you experience persistent pain or discomfort, it is essential to see a doctor to identify the underlying cause and receive appropriate treatment. Number 2. Consume too much salt. Although salt plays a crucial role in the functioning of our body, excessive consumption can become a silent enemy for our kidneys. It is true that salt is essential to maintain fluid balance and nerve and muscle function, but exceeding its intake can have serious consequences for kidney health. This is because salt has sodium, which can raise blood pressure and make the kidneys work harder to remove excess fluid and sodium from the body, which can lead to stress and long-term kidney damage. High salt consumption contributes to high blood pressure, one of the main risk factors for chronic kidney disease. High blood pressure can damage the small blood vessels in the kidneys and reduce their ability to filter blood. In fact, it is one of the leading causes of kidney damage or failure. Salt retains water in the body, which increases blood volume and pressure on the kidneys. High salt consumption can increase the risk of kidney stones, painful mineral deposits that form in the kidneys. How much sodium is too much? The World Health Organization recommends limiting daily sodium intake to less than 5 grams, about a teaspoon. However, most people consume much more than this, reaching up to 10 grams or more per day. This is mainly due to the intake of high-sodium processed foods, such as canned soups, frozen meals, snacks, sauces, and condiments. To reduce your salt intake, try eating more fresh fruits and vegetables. Cook your own food from scratch, using herbs and spices. When purchasing packaged foods, read nutritional labels carefully to make sure they are low in salt. Number 3. Ignore the urge to urinate. Do you ever hold your urine because you are busy or don't have a bathroom nearby? This may be putting your kidneys at risk. By ignoring urination, you allow urine to stay in the bladder longer, which can cause bacteria to grow and lead to urinary tract infections. These infections can be painful and uncomfortable, and if left untreated, they can spread to the kidneys and cause serious damage. So the best thing you can do to prevent urinary tract infections and protect your kidneys is to listen to your body and go to the bathroom when you need to, not hold your urine, and also try to completely empty your bladder every time you urinate. Number 4. Not sleeping enough. Sleep is essential for your health and well-being. But did you know that sleeping also affects your kidney health? Your kidneys follow a circadian rhythm or a natural 24-hour cycle that regulates their function and activity. When you sleep, your kidneys reduce their workload and rest. When you wake up, your kidneys resume their normal function and filter more blood. This cycle helps your kidneys maintain their efficiency and balance. But when you don't get enough sleep, your circadian rhythm is disrupted and your kidneys can't do their job properly. According to a study published in the Journal of the American Society of Nephrology, people who slept less than 5 hours per night had a 65% higher risk of developing kidney disease than those who slept 7 to 8 hours per night. Another study found that people who slept more than 9 hours a night also had a higher risk of kidney disease. This suggests that sleeping too little or too much can be harmful. The recommended amount of sleep for adults is 7 to 9 hours per night. To improve the quality and quantity of sleep, try to follow a regular schedule. Avoid caffeine, alcohol, nicotine, and heavy foods. Before bed, limit screen time and exposure to bright light. Create a comfortable, dark environment for sleeping and practice relaxation techniques such as yoga meditation or breathing exercises. Number 5. Eat a lot of meat protein. Meat protein is a good nutrient for your body, but too much animal protein can be bad for your kidneys. Animal protein produces a large amount of acid in the blood that can damage the kidneys and cause acidosis, a condition in which the kidneys cannot remove acid quickly. This can lead to kidney stones, bone loss, muscle atrophy, and chronic kidney disease. So, how much protein do you need? The dietary reference intake for protein is 0.8 grams per kilogram of body weight per day for adults. This means that the average person weighing 70 kilograms, or 154 pounds, needs about 56 grams of protein per day. But this amount can vary depending on age, activity level, health, and personal preferences. To keep your protein intake balanced and moderate, try to include more plant-based protein sources in your diet, such as beans, lentils, nuts, seeds, tofu, and quinoa. These foods are not only high in protein, but also low in acid and rich in fiber and antioxidants. Number 6. Not drinking enough water. Water is essential for life, and for the kidneys, it helps them eliminate toxins and waste products from your body. Without enough water, these waste products can build up and cause problems such as kidney stones and chronic kidney disease. In fact, drinking plenty of water is one of the best ways to avoid kidney problems and keep them functioning well. So, how much water do you need? The amount of water you need depends on many factors, such as your age, weight, activity level, climate, and health conditions. The general rule of thumb is to drink at least 1.5 to 2 liters of water per day. However, you may need more or less depending on your individual needs to stay hydrated. Staying hydrated is essential for overall health, and this is especially important for the health of your kidneys. Drinking enough water throughout the day helps your kidneys function properly, removing toxins and waste from your body. You can also drink other liquids such as infusions, juices, or soups, but avoid drinks that contain caffeine, alcohol, or sugar, as they can dehydrate you and damage your kidneys. Number 7. Eat processed foods. Processed foods are foods that have been altered from their natural state, usually by adding salt, sugar, fat, preservatives, artificial colors, or flavors. Processed foods have delicious flavors, and they are also very convenient for a quick meal in the fast-paced world we live in, which hardly gives us time to prepare food naturally. The counterpart of processed foods is that they are very harmful to the kidneys, as they are high in sodium and phosphorus, two minerals that can cause high blood pressure and kidney stones if consumed in excess. According to a study published in the American Journal of Kidney Diseases, people who ate more processed foods had higher levels of phosphorus in their blood, which can lead to kidney damage over time. So what can you do to avoid processed foods? Try to eat more fresh fruits and vegetables, whole grains, lean proteins, and healthy fats. Cook your meals at home as much as possible, and use herbs and spices instead of salt to flavor your foods. If you have to buy packaged foods, choose options low in sodium and phosphorus. Number 8. Not getting enough exercise. Physical exercise helps you maintain a healthy weight, which reduces the risk of obesity and diabetes, two of the main causes of kidney disease. Exercise also helps lower blood pressure, which protects the kidneys from damage. According to a study published in the Journal of the American Society of Nephrology, people who exercised regularly had a significantly lower risk of developing kidney disease. The recommended amount of exercise for adults is at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity per week. It is also advisable to do muscle strengthening exercises at least twice a week. Number 9. Smoke. It is one of the worst habits for health in general. Smoking damages blood vessels, which reduces blood flow to the kidneys and can affect their ability to function properly and filter waste and toxins. Smoking also increases the risk of developing kidney cancer, one of the most common and aggressive types of cancer. According to a study published in the Journal of the American Society of Nephrology, smokers had a 60% higher risk of developing kidney failure than non-smokers. If you are a smoker, it is very important to quit tobacco as soon as possible. Remember that quitting smoking is not only good for your kidneys, but also for your lungs, heart, brain, skin, teeth, and general well-being. Number 10. Drinking alcohol excessively. Alcohol is a diuretic, meaning it makes you urinate more frequently. This can dehydrate you and make your kidneys work harder to maintain fluid balance in your body. Alcohol also affects the liver, which produces a substance called urea that the kidneys are responsible for filtering. When you drink too much alcohol, your liver produces more urea than your kidneys can process, which can cause kidney damage. So what can you do to limit your alcohol consumption? The recommended limit for alcohol consumption is no more than 1 drink per day for women and 2 drinks per day for men. If you drink alcohol, drink it slowly, accompanied by food, and at the end with water or other non-alcoholic drinks. Avoid drinking on an empty stomach or when you are thirsty or tired. Your kidneys are vital organs that deserve care and attention. By avoiding these 10 bad habits, you can improve your kidney health and prevent or delay the progression of diseases. Remember that prevention is always better than cure. Taking care of our kidneys is a responsibility that directly impacts our health and general well-being. By adopting healthy habits, such as drinking enough water, maintaining a balanced diet, engaging in regular physical activity, and avoiding harmful habits, such as smoking and excessive alcohol consumption, we can protect these organs and ensure their proper functioning in the long term. While kidney disease can be a serious problem, detecting it early and taking preventive measures can help preserve kidney function and improve quality of life. Don't ignore the warning signs and take care of the health of your kidneys. If you are concerned about the health of your kidneys, consult your doctor for a kidney checkup and receive personalized recommendations. If you have risk factors or symptoms such as fatigue, swelling in your feet, changes in urinary habits, or blood in your urine, it is important to see a doctor for screening. Early detection is key to preventing the progression of kidney disease and protecting the health of these vital organs. Take charge of your health and protect these essential organs for a full and healthy life. Tell us about yourself in the comments. Do you have or did you have any of these habits? How do you fight these bad habits? Your opinion and advice are very important. How do you take care of your kidneys? Tell us about your experiences. Thank you for joining us. If you liked it, give us a like. Subscribe to the channel so you don't miss every content we upload. See you in the next video.